One of the leading causes of death in Canada is cancer. Approximately 2 in 5 Canadians will develop cancer at some point in their lives, with 1 in 4 eventually dying because of it. So what makes cancer so deadly? Besides a number of factors, we'll be focusing on how it's because there is no single medication or drug that we can give to cure it, which is why it is so hard to treat. So right now you may be thinking, if there is no cure, and this is a terrible disease, what's the point of this presentation? Well, while cancer cannot be cured in one treatment per se, the main treatment option for cancer patients is what is called chemotherapy. Now, do not get us wrong. We are not discussing the cure for cancer, but rather looking at some pros and cons to some of the methods we have developed to neutralizing its negative effects. First, let's clear up some misconceptions about cancer. It is most often considered a singular disease, but is in fact an umbrella term which includes 100+ diseases. In order for cancer to develop, 2 mutations must first occur for a cell to become a tumor. First, the cell loses its ability to divide at a normal rate and to receive signals from the body to stop dividing. This causes the cell to divide uncontrollably and to begin its process in creating a tumor. The second mutation causes the cell to lose its ability to perform apoptosis. Apoptosis is the self-destruction of a cell and occurs when it can no longer divide or its DNA is damaged beyond the cell's ability to repair it. Genetic mutations happen in our bodies at a pretty common rate. In fact, every time a cell replicates, the enzymes that are supposed to replicate our DNA make about 120,000 mistakes. And we all have 37.2 trillion cells in our body. However, we have some sort of proofreading mechanism in our bodies that catches about 99% of these mistakes. And on the off chance our body cannot fix the mistake, it performs apoptosis or cell suicide. But tumor cells don't do this. They keep replicating and eventually create a mass of damaged cells. This is a benign tumor. If it's removed via surgery, for example, then our bodies will go back to normal. But sometimes this clump of cells asks the body to feed it, so the body creates blood vessels to the tumorous mass and provides it with nutrients to continue growing. This is when the benign tumor can become malignant. When the blood vessels connect to the tumor, some cells will eventually break off and enter the bloodstream. From here, they can travel to any point in the body and set up camp in a new location. We now have cancer.
Cancer is usually treated with a combination of procedures that most often include chemotherapy. There are many different types of chemotherapy drugs, all of which are meant to treat different types of cancers, or whether it's acute or chronic, or what stage the cancer was diagnosed at. Your first batch of chemotherapies would be the alkylating agents. These types of chemotherapy can affect a cell no matter what phase of the cell cycle it is in. A common alkylating agent would be a mustard gas derivative like mechlorethamine. This compound is characterized by having nitrogen attached to a methyl group and 2 chlorines. It works by forming bonds in the DNA and subsequently breaking it up, resulting in cell death. This type of therapy is generally used for lymphoma, cancers which affect the white blood cells. Side effects from taking this type of treatment would be nausea and vomiting, weakness, drowsiness, headache, and confusion. Next, you have your plant alkaloids. These compounds are derived from different types of plants like the May apple plant or bark from the yew tree. One type of plant alkaloids are vinca alkaloids, which include vincristine. Its formula is C46H56N4O10. It's usually derived from the periwinkle plant or vinca. This works by inhibiting the cancer cells from dividing, blocking the growth of the cancer. Vincristine itself works by binding to a certain protein in the cell during metaphase, preventing the cell to split its chromosomes, which forces it to die. Vincristine is used to treat a number of cancers, including, but not limited to, acute leukemia, Hodgkin's and non-Hodgkin's lymphoma, neuroblastoma, thyroid cancer, brain tumors, and more. However, a serious side effect is that 1 in every 10 people will become infertile after receiving this type of treatment. Third on the list are the anti-tumor antibiotics. These guys are made from the soil fungus Streptomyces. They are considered cell-specific because while they cannot target they are considered cell-specific because while they can target multiple types of cells in different phases, they cannot attack all. One example would be doxorubicin, which is in the group anthracycline of the antibiotics. It's used to treat some leukemias, Hodgkin's lymphoma, and cancers that affect the bladder, breast, stomach, lungs, ovaries, thyroid, soft tissue sarcoma, multiple myeloma, and others. However, its side effects include severe skin, tissue, or muscle damage if it leaks from the circulatory system. Next are the antimetabolies, which work by posing as similar substances the cells would use for normal cell function. Once absorbed, they are incorporated into the cellular metabolism and prevent the cell from dividing. These are cell cycle specific and depend on what substances they are mimicking. One example is fludarabine, which is an adenosine deaminase inhibitor. It's used to treat cancers such as chronic lymphocytic leukemia, or CLL. Lastly, miscellaneous antineoplastics. There are miscellaneous antineoplastics. These guys are unique and target cancer cells using different methods than the other ones we just mentioned. Keep in mind that there are many other types of chemo treatments, including topoisomerase inhibitors, targeted therapy, immunotherapy, hormone therapy, and more. Despite all of this, chemotherapy is the most often used medication to help control and minimize the effects of cancer due to its results. Millions of cancer patients have been able to enjoy happy, healthy lives after chemo treatment. Not to mention that more than 50% of people diagnosed with cancer are treated with chemotherapy.
Now, we talked a lot about chemotherapy, but let's discuss the other types of cancer treatments that are available to people, as each type of treatment may affect individuals with the same cancer differently. The other two most common options for cancer treatment are surgery and radiation therapy, but there are also other treatments that are available out there, and that includes immunotherapy, which is a less popular option among those who undergo cancer treatments, but they may prove to be extremely effective for some patients. Immunotherapy, also known as biologic therapy, is a type of cancer treatment that focuses on restoring and/or improving the whole immune system. It works in one of two different ways, depending on the specific treatment. One way activates a stronger than normal immune response in order to fight the cancer. The second way teaches the immune system how to spot cancer cells and destroy them. An example of one immunotherapeutic treatment is oncolytic virus therapy, which is a therapy where a virus would be injected into the tumor, where the virus will make copies of itself, causing the cells of the tumor to burst and die. As these cancer cells die, they release a substance called an antigen, which triggers the patient's immune system to target all cancer cells with same antigens in the body. Another example of an immunotherapeutic treatment is the Gerson therapy, named after Dr. Max Gerson, who created this cancer treatment based on having a clean, natural, and nutrient-rich diet in order to restore the body's amazing ability to heal itself by detoxifying the body and battling nutritional deficiency, which is the cause of most degenerative diseases. An example of the daily diet of someone on the Gerson therapy consists of the following things: 1 glass of raw, fresh-pressed juice every hour up to 13 times a day, 3 full plant-based meals, fresh fruit and vegetables for snacking throughout the day, coffee enemas, with the addition of some recommended supplements to help the body take in all of the nutrients. One of the nutrients is oxygen, so oxygenation is one of the most important parts of the diet, because oxygen deficiency contributes to many degenerative diseases, and it is known that cancer cells cannot survive in highly oxygenated environments. Next, metabolism, which is key to the processing abundance of nutrients taken in throughout the day, is stimulated through thyroid, potassium, and other supplements, and by avoiding heavy animal fats, excess proteins, sodium, and other toxins. The detoxification process, a highly important process of the Gerson therapy, is assisted by the use of coffee enemas that help the liver clean and rid the body of toxins permanently. All in all, many diverse methods to treating cancer have been developed, with chemotherapy being the go-to choice for most, and oftentimes paired with another treatment. Hopefully, we have debunked some myths about cancer and chemotherapy that you may have heard, and that you learned a little something about cancer and the different ways it can be treated. Thanks for watching.